Welcome to Toronto Children's Services' most recent updates module. Toronto Public Health made some changes to their guidance document the week of October the 5th. This module provides a quick update on those changes. The module does not replace the existing modules. The full training modules must be viewed in order to meet the mandatory training requirements. Let's begin with changes to the screening process. The screener needs to verify whether electronic screening has been completed by the individual prior to arrival, and if it has, the screener reviews the results. If the individual has not completed the electronic screening, in-person screening must be conducted. The following screening questions and symptoms apply for both electronic and in-person screening. If the individual answers no to all questions, they have passed the screening and the child can enter the building. If they have answered yes to one of the following symptoms: sore throat, stuffy runny nose, headache, nausea, vomiting, diarrhea, or feeling unwell muscle aches, they are to stay home for 24 hours from when the symptoms started. If the symptoms are improving in 24 hours, the child can return to the program. If they are not improving or getting worse, the child must self-isolate and get tested. If the individual answers yes to any of the other screening questions, including having 2 or more symptoms, or refuses to answer, they have failed the screening and cannot enter the building. Direct these individuals to go home, self-isolate, and get tested or contact their healthcare provider. Now we will look at when a staff, provider, student, or child needs to be excluded from the childcare setting. When a staff, provider, or student tests positive for COVID-19, the individual must inform their supervisor or home visitor and self-isolate for 10 days from the first day their symptoms first appeared. Individuals who are being managed by Toronto Public Health must follow their instructions, including when they can return to work. All staff, students, and children who were in the same room or home as the ill staff or provider must be excluded for 14 days and self-isolate. When a child tests positive for COVID-19, the parent or guardian must inform the childcare centre or home childcare immediately and self-isolate for 10 days from the first day their symptoms first appeared. Children who are being managed by Toronto Public Health must follow their instructions, including when they can return to the program. All staff, providers, students, and children who were in the same room as the ill child must be excluded for 14 days and self-isolate. When a close contact tests positive for COVID-19, staff, providers, students, or children who have been in close contact with a positive COVID-19 case must inform the childcare centre or home childcare immediately. The individual must self-isolate and will be excluded from the program for 14 days from the first day of their last exposure. Individuals who are exposed to a confirmed case of COVID-19 should get tested. If the test is negative, the individual still needs to self-isolate for the 14 days. Staff, students, and children who are being managed by Toronto Public Health, for example, a confirmed case of COVID-19 or close contacts of cases, must follow their instructions to determine when to return to the childcare centre or home childcare. Please note, a sibling of an ill child does not need to be excluded until it is confirmed the ill child has a positive COVID-19 case. There are changes on how and when to report cases to Toronto Public Health. When a staff, student, or child has a laboratory confirmed case of COVID-19, the program must immediately report the laboratory confirmed case to Toronto Public Health by completing the Toronto Public Health COVID-19 notification form for childcare settings. Only confirmed cases of COVID-19 are now reported to Toronto Public Health. Additional support can be accessed by calling Toronto Public Health at 416-338-7600. Continue to take direction from Toronto Public Health on who should be excluded. Toronto Public Health have developed 2 new resources for programs: COVID-19 Decision Guide and the Returning to Childcare Confirmation Form. The Decision Guide provides clarification and guidance when a child should be excluded and for how long. The Returning to Childcare Confirmation Form will support programs when children are returning to the program after being excluded. Instead of requiring parents or guardians to provide doctor's notes or some other type of documentation to demonstrate the child is able to return, the confirmation form can be completed by the parent to declare their child is well and able to return to the childcare setting. That concludes the Updates module. Please inform your supervisor or director that you have completed this training module. We have provided a list of additional resources for you to access, and they can be found on the website along with this video.